Hello. Today's topic is about aorta and its branches. The aorta is the largest artery in the body and it receives the cardiac output from the left ventricle and supplies the body with oxygenated blood via the systemic circulation. If you haven't watched my video regarding systemic circulation, I will put the link in the description below. The aorta can be divided into four sections that are the ascending aorta, the aortic arch, the thoracic aorta and the abdominal aorta. It terminates at the level of L4 by bifurcating into the left and right common iliac arteries. Let us first talk about the ascending aorta. The ascending aorta arises from the aortic orifice from the left ventricle and it ascends to become the aortic arch. It is 2 inches long in length and travels with the pulmonary trunk in the pericardial sheath. The ascending aorta has 2 very important branches that are the left and right coronary arteries that supply the myocardium. Next, it arches and forms the aortic arch. The aortic arch begins at the level of the second sternocostal joint. It arches superiorly, posteriorly, and to the left before moving inferiorly and ends at the level of the T4 vertebra. It is connected to the pulmonary trunk by the ligamentum arteriosum, which is a remnant of the fetal ductus arteriosus. There are 3 major branches arising from the aortic arch. From the right, we have the large brachiocephalic trunk which ascends laterally to split into the right common carotid and right subclavian arteries. These arteries supply the right side of the head and neck, and the right upper limb. Next, we have the left common carotid artery which supplies the left side of the head and neck. The last branch is the left subclavian artery which supplies the left upper limb. The knowledge of the aortic arch is important because of a clinical condition known as coarctation of aorta. Coarctation of aorta refers to the narrowing of aorta usually at the insertion of the ligamentum arteriosum. Coarctation of aorta is congenital condition. What happens is that the narrow vessel has an increased resistance to blood flow which in turn increases the afterload of the left ventricle. This will eventually lead to left ventricle hypertrophy. The important thing to be kept in mind is that the blood supply to the neck, head, and the upper limbs are not compromised as the vessels that supply them emerge from proximal to the coarctation. However, the blood supply to the rest of the body is reduced. This will result in weak, delayed femoral pulse which presents as radiofemoral delay. Next, we journey to the descending aorta. The descending aorta can be divided into 2 parts according to its region. The part that descend in the region of thorax is called as thoracic aorta and the part in the abdomen is called as abdominal aorta. We will first look at the thoracic aorta. The thoracic aorta spans from the level of T4 to T12. Continuing from the aortic arch, it initially begins to the left of the vertebral column but approaches the midline as it descends. It leaves the thorax via the aortic hiatus in the diaphragm and becomes the abdominal aorta. The branches of thoracic aorta in descending order are the bronchial arteries which supply bronchial, peribronchial tissue and visceral pleura. Next are the mediastinal arteries that supply the lymph glands and loose areolar tissue in the posterior mediastinum. Going down we have the esophageal arteries which supplies the esophagus. Then there are the pericardial arteries which supply the dorsal portion of the pericardium. Then there are superior phrenic arteries that supply the superior portion of the diaphragm. The last branch are the intercostal and subcostal arteries which supply the intercostal spaces, with the exception of the first and second because the first and second are supplied by a branch from the subclavian artery. The subcostal arteries supply the flat abdominal wall muscles. Next we will look at the abdominal aorta. The abdominal aorta is a continuation of the thoracic aorta beginning at the level of the T12 vertebrae. It is approximately 13 centimeters long and ends at the level of the L4 vertebra. At this level, the aorta terminates by bifurcating into the right and left common iliac arteries that supply the lower body. The abdominal aorta gives out numerous branches which I will go through in detail in my upcoming videos. However, here is an overview. The first branch are the inferior phrenic arteries which supplies the diaphragm. In descending order, we have the large celiac trunk that arises anteriorly at the level of T12 which supplies the foregut structures of the abdomen. Next we have the superior mesenteric artery, which arises at the level of L1 and supplies the mid-gut structures of the abdomen. Going further down, we have the middle suprarenal arteries that are paired arising at the level of L1 to supply the adrenal glands. Moving down, there are the renal arteries that are paired arising laterally at the level between L1 and L2 to supply the kidneys. Gonadal arteries are the next one. These are paired arteries that arise at the level of L2. Next is the inferior mesenteric artery, which is a large, unpaired visceral artery that arises anteriorly at the level of L3. It supplies the hindgut structures of the abdomen. In the middle of the bifurcation we have median sacral artery, which is an unpaired parietal artery that arises posteriorly at the level of L4 to supply the coccyx, lumbar vertebrae, and the sacrum. We also have the lumbar arteries, which arise posterolaterally between the levels of L1 and L4 to supply the abdominal wall and spinal cord. An extremely important clinical anatomy is the abdominal aortic aneurysm, or also known as AAA. First, you have to understand what is the meaning of aneurysm. An aneurysm is a dilatation of the artery to more than 1.5 times the original size. Aneurysm can happen anywhere in any artery, but the abdominal aorta is the commonest site for aneurysm. Aneurysm is a large and important topic for medical, which I will talk in the upcoming video. A patient with this condition of AAA has abdominal pulsations, back pain, and abdominal pain. Usually small aortic aneurysm do not pose a serious immediate threat. Diagnosis is made by ultrasound. The most important thing is it is a medical emergency. If left untreated, this is fatal case. As usual, there are quiz questions. Pause this video and answer them. Comment your answers below. As usual, please like, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.